I'll now go over the steps for your endovascular laser therapy procedure at Sina Surgery Center. Thickened, sometimes twisted and dilated parts of the veins are called varicose veins. They could possibly bulge and be visible, and can appear as unsightly nuisances on your legs. Varicose veins can occur on any part of the vasculature. For example, they can occur in your pelvic, vaginal, or testicular veins, but they mostly present in the lower extremities. Varicose veins don't play favorites either. They affect both men and women. Overall, 35% of the female population and 25% of the male population is affected. Arteries carry blood from your heart to the rest of your body. Veins return this blood back to your heart to complete the circulation. The lower leg has three main types of veins. They are the deep veins, superficial veins, and perforator veins. The femoral vein and the deep vein of the thigh make up the deep vein system. The great saphenous vein and the lesser saphenous vein make up the superficial vein system. Normally, blood flows from the superficial vein system to the deep vein system by way of the perforator veins, which connect the two systems together. Within the veins of the legs, there are tiny one-way valves. These valves only work in one direction. As the blood flows up towards your heart, these valves open and allow blood to move. Once the blood stops moving, these valves close and prevent the blood from going back down toward your feet. To assist with this movement, muscle contractions in your lower leg and calf work as pumps. All of this together helps your blood return to a network of larger veins, such as the pelvic veins and vena cava, and eventually back to the heart. About 90% of the blood in your lower legs will flow through the deep vein system, and about 10% of the blood in your lower legs will flow through the superficial vein system. Varicose veins primarily occur in the superficial vein system. The two most important factors leading to varicose veins are vein valve dysfunction and superficial veins that are not located within the muscle layer. Up to 80% of varicose vein cases are due to vein valve dysfunction. Vein valves normally function as such to promote the blood flow toward the heart. But in cases of dysfunction, blood will reflux and flow backwards, causing the vein to fill. As stated earlier, superficial veins are not surrounded by muscular layers. Because of this, there is typically no effective pump action on the vein to propel the blood toward the heart. This causes more blood to remain in the vein system. When this happens, the superficial vein will dilate and could become twisted and visible. We call this varicose veins. Below are some additional risk factors. Genetics. Females develop varicose veins more than men. Valve dysfunction is mainly genetic and more common among people with positive family history. Obesity. Obesity leads to increased intra-abdominal pressure. This leads to higher resistance to blood flow from the legs to the heart. Pregnancy. As with obesity, developing fetuses cause a higher resistance to blood flow toward the mother's heart. Additionally, increased hormonal production during pregnancy causes the veins of the legs to relax. Did you also know that your blood volume is increased during pregnancy? Higher blood volume means more blood congestion in the lower legs, possibly leading to varicose veins. Profession. Prolonged standing is very hard on the veins of your lower extremities. Gravity has an astounding negative effect on these veins. Once varicose veins develop, most, if not all, are permanent and lifelong. They may not regress and get better. Varicose veins aren't merely an aesthetic problem. They're also a medical problem. Varicose veins can be painful and cause swelling, aching, throbbing, itching, leg fatigue, and heaviness. They can ultimately lead to chronic vein insufficiency. Chronic vein insufficiency can lead to scarring, dark pigmentation, skin infection, thrombosis, and ultimately leg ulcers. If you have severe varicose veins, you have a slightly increased chance of developing deep vein thrombosis. Deep vein thrombosis may cause sudden and severe leg swelling, and in rare occurrences may even lead to lung embolization. Deep vein thrombosis is a serious condition that requires immediate medical attention. These symptoms may develop even without visible varicose veins. There are two treatment options for varicose veins. The first option is medical therapy. This treatment option consists of wearing compression stockings, elevating your legs, and walking. All of these may reduce the symptoms, such as pain and swelling, but they won't cure the varicose veins. Once varicose veins develop, they may not get better. They could become a lifelong problem and could possibly lower your overall quality of life. This is why you may be required to wear compression stockings for the rest of your life if you choose the medical therapy option. The second option is surgical therapy. There are two types of surgical therapy: vein stripping or ligation and minimally invasive vein ablation. Vein stripping requires general anesthesia and multiple skin incisions, which could promote some scarring. This type of surgical therapy requires a hospital setting and has a higher recurrence rate than vein ablation. We do not do this procedure in our facility for these reasons. Minimally invasive vein ablation can be done with two types of modalities: radiofrequency ablation, RFA, and endovenous laser therapy, or EVLT. EVLT is our preferred method of treatment. Endovenous laser therapy, EVLT, uses targeted laser energy to seal the inside of the vein shut. Under local anesthesia and using ultrasound guidance for assistance, a catheter is placed into the varicose vein. Then the laser fiber is passed through the catheter and secured in place. A local anesthetic mixture is then administered. The local anesthetic mixture helps numb the treatment area, acts as a buffer between the vein wall and the surrounding tissue, and helps compress the vein against the catheter. Next, the laser fiber is activated and continuously pulled back with the catheter through the entire treatment length. After this short procedure, a simple leg dressing and compression stocking is applied. After just a short period of recovery, you're free to leave the center. The possible side effects of EVLT are pain, bruising, temporary leg numbness, phlebitis, infection, skin burn, and, in rare occasions, deep vein thrombosis and lung embolization. There are many benefits of treating your varicose veins with EVLT as a minimally invasive procedure. These benefits include, but are not limited to, no hospitalization, no general anesthesia, minimal to no scarring, same-day walk-in, walk-out procedure, no downtime, return to work the next day. It can be performed in an outpatient surgery center, up to a 98% success rate, higher than most other methods, including vein stripping. Immediate relief of symptoms, covered by most insurance companies. It is a medically indicated procedure, not cosmetic. We will interact with your insurance carrier to assess your eligibility. Also, 1 month following your surgery, you may have cosmetic sclerotherapy for treatment of your spider veins if needed. This can be performed right here in our facility. Thank you for taking the time and learning more about Sina Surgery Center and our varicose vein practice. Please feel free to call on us if you have any unanswered questions after visiting this site. We will provide weekly seminars and encourage you to join us for these.